Starting Medicare can be complicated for a lot of people. You have to make a lot of choices and understand things that you didn't need to really understand before. And you want to make sure that you get it right, because it's going to be really important as we get older, certainly, to make sure that healthcare goes the way that we want it to go. And Medicare is actually terrific as long as we get it right. But a lot of people face challenges because they have to rely on somebody selling them different things, and you want to make sure that you understand it. So that's really my goal, is to make sure you understand your choices before you make them. And something that surprises quite a few people is Medicare is not free. There's costs involved within Medicare in a lot of different places, and we need to understand exactly how those costs work so we don't have surprises, certainly with financial issues when it comes into our retirement, and that things go exactly the way that we want. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit talkingmedicaregroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. So I'm going to break down in this video the different costs that are involved with Medicare. And again, they're in a lot of different places, so we need to know what our bottom line is going to be when it comes to how much we're going to spend going forward. So first, we need to understand the choices. So when you come into Medicare, you really have two main choices. You have either staying on original Medicare or going into a Medicare Advantage plan. And right now it's about 50-50, where half the people are going into Medicare Advantage, half the people stay on original Medicare. And I'll tell you, if you see any of my videos, you know I 100% recommend doing whatever you can to stay on original Medicare, because it's terrific. A lot of people get sold into Medicare Advantage plans because those are the commercials that you see on TV. They're run by private insurance companies, and they're for-profit insurance plans, where Medicare is not. Medicare is run by CMS, the Center for Medicare Services. So it is not a for-profit business like a Medicare Advantage plan. But there are major differences between the two. That's kind of a different video. I certainly have videos on the differences between original Medicare and Medicare Advantage. Make sure you check into those so that you understand those differences. But right now we're going to talk about the costs that are associated within Medicare. And we're going to start with original Medicare, Part A and Part B. And the first shocking thing that people find is Medicare Part B has a premium. So there is a monthly premium to Medicare Part B. And understand, you're going to pay that premium regardless of whether you stay on original Medicare or if you go into a Medicare Advantage plan. That's something else that confuses people. They think if they go to a Medicare Advantage, they don't have to pay their Medicare Part B premium, but that's not the case. Medicare Part B has a premium, and right now in 2024, that premium is $174.70 per month. So in order to start your Medicare Part B, you're going to have that monthly premium of $174.70 a month. And the way that will work is if you are drawing Social Security, so if you're coming into Medicare 65 or even later, if you've already started your Social Security, then Medicare will take that out of your Social Security check. So if you have not yet started your Social Security, Medicare is going to send you a bill for that $174 a month. And they're not going to send you a bill every month. They're going to send you a quarterly bill. So you're going to have to pay that 3 months at a time. Another surprising thing to many, where they get this big bill and they weren't expecting it. But it is over a 3-month period. So just understand that if you're not drawing Social Security, you're going to pay quarterly for your Medicare Part B. If you are drawing Social Security, then it will come automatically out of your check. Now, something else with this Medicare Part B premium that surprises a lot of people. It's income adjusted. So there's something called Irmaa, which adjusts that premium based on your income. And it can be a significant adjustment. And the way this adjustment works is they have to look at your income from 2 years ago, because that's the income that they have access to see from your tax returns from 2 years ago. So you might have been making more money 2 years ago than you're making now, but that is what Medicare or Social Security is going to look at to determine your Medicare Part B premium. And right now, in 2024, if your income from 2 years ago, 2022, was 103,000 single or 206,000 joint or less, you pay that 174 monthly standard Part B premium. If it's more than that, more than the 103 or 206, you're going to pay more for your Medicare Part B premium. And I have a sheet where I have all these numbers on it. I'm going to put the link below the video. You can download the sheet. Easy to have. You want to have it, keep it so you know exactly what your costs are. But it's going to break the Irmaa numbers down. And there are different categories for Irmaa. The highest level on Irmaa is if you make $500,000 single or $750 joint. And it's kind of an odd scenario there because every other category seems to double between single and joint. The high category does not. It's 500 single, 750 joint, and certainly there are people that make this kind of income, and what it's going to do to your Medicare Part B premium is take it from that $174 a month to $594 a month. So from $174 to $594 a month for your Medicare Part B. And if it's you and your wife, you can times that by 2. So it can be a significant increase and then back up to where if you're not drawing Social Security, they're going to send you a bill quarterly. So 3 times that number for the quarterly payment for your Medicare Part B premium. So that is the first thing to understand with Medicare coming in, and regardless of which avenue you choose. But most people are going to pay the standard rate, the $174, but you could pay as much as almost $600 a month for your Medicare Part B. So we need to certainly come to grips with that coming in. Now, something else within Original Medicare that falls under Irmaa, the adjustment for income, is Medicare Part D, which is Medicare drug plans. So if you're on Original Medicare A and B, you're probably going to get a Medicare supplement plan that's going to cover the things that A and B don't, like deductibles and co-insurance and stuff like that. I'll get to that in a second. And likely a Medicare drug plan. So Medicare drug plans are standalone within Original Medicare. So you get a separate Medicare drug plan. And there is a premium to that. Some Medicare drug plans right now have little or no premium. They could be as much as 0 or 50 cents a month, but Irmaa does apply. So the same level of income, that 103 or 206, you're going to pay the standard cost for that Medicare Part D. If you have income above that, again, from 2 years ago, then it's going to be an additional amount on top of whatever the regular premium is for that Medicare Part B or Part D drug plan is. And the highest level, that 500 or 750 single or joint, if you make more than that, is going to add $81 a month to that Part D premium. So again, we need to understand this part. I just had somebody recently that signed up for a zero cost drug plan because they didn't take any medications, but it actually, because of Irmaa, cost $81 a month. So it'll put you in a position where you really need to determine on whether or not you purchase a drug plan, especially if you don't take any medications. Now, why that's a more difficult decision with drug plans, it's also kind of crazy. They have a penalty if you do not enroll into a drug plan when you first become eligible in Medicare. There is a penalty if you enroll later. And it's not a huge penalty, but it runs at 1% per month. And it sounds like a lot, but when you factor it out, it may add down the line, if you needed it down the line and you came into a Medicare drug plan later, it could add $5, $10, $15, maybe more a month on top of the regular premium, plus maybe even on top of that Irmaa. So you need to understand that with drug plans, and drug plans are going to change significantly pretty soon because the government just initiated a maximum out-of-pocket cap, which is going to be at $2,000. So not many people ever get to that level, but some do. But now you won't have any exposure after that $2,000. And what that's going to do is it's going to affect premiums pretty significantly coming forward. We haven't seen that picture yet on exactly what it's going to do, but it is coming. And there are also some changes coming to Medicare Advantage where you think maybe my Medicare Advantage is an option that I might want to take based on cost. Things are going to change significantly there as well because there have been some heavy losses recently within Medicare Advantage, those for-profit insurance carriers where their stocks have really taken a hit and adjustments are going to be made. So just prepare. Coming up in this next open enrollment period, Medicare Advantage is going to have a whole different look to it. So you won't see as many certainly happy TV commercials giving this away or giving that away. It's going to change pretty significantly. So let's dig a little deeper into original Medicare and kind of understand why, if we're going to stay on original Medicare, and again, that's what I would do. I would recommend it to just about anyone if you can, why we would want a Medicare supplement plan. And it's pretty simple. So Medicare, and I won't get deep into the costs on original Medicare, but you wouldn't have A and B without a supplement. It just doesn't make sense. There's too much financial risk to it. So Part A, which covers stuff that happens inpatient in the hospital, has a big deductible. Right now, that deductible is $1,632. That's a big deductible. You wouldn't want that deductible if you're getting admitted into the hospital. And not only that, it's not a calendar year deductible, it's a per occurrence deductible. So there's the possibility that you could have it 2 or 3 or more times in the same year, that's $1,632. So the good news is most Medicare supplement plans cover that deductible. So it makes it very easy to understand there why you would have a Medicare supplement plan. So that's on Medicare Part A. Medicare Part B is things that go on outside the hospitals, doctor visits, specialist visits, outpatient surgery, all that kind of stuff, all the regular kind of stuff that does not pertain to an inpatient hospital admission. And Medicare pays 80%. There's a small deductible with Medicare Part B. Right now is $240, and that is an annual deductible. So $240 annual deductible on Medicare Part B is not something that we would get terribly concerned with because it's somewhat manageable. But after the deductible, Medicare pays 80%, and you're responsible for 20%. Also, doesn't sound too bad. That's kind of the way insurance used to be back in the old days. You'd have a deductible, and then you were on 80-20 insurance, where you were responsible for 20%. And that's kind of the way insurance should be because it puts some responsibility on us because there will be costs involved to make sure that we don't utilize things that we don't need to utilize, that we put a little thought into what we're going to do. But with Medicare, the 80-20, again, doesn't sound too bad. The problem is the 20% doesn't have a cap. So there's no limit on the 20% of the out-of-pocket expense with Medicare Part B. So on a normal year, no big deal. But if you were to have a catastrophic year, if you had a $100,000 medical bill outside of the hospital, you'd be responsible for $20,000. That's obviously not something that we want to have exposure to. So a Medicare supplement plan helps take care of the coinsurance that's Medicare Part B. Now, when we're talking about the supplement plans, and this is what we do, we help find the best Medicare supplement plan in your zip code. We work anywhere in the country. We work with all insurance carriers, and we find the best value for you. So certainly would appreciate if you allow us to help you. We make it as easy as possible. We don't push or sell. We just find the best value. And I'll tell you exactly what I think, what I would do, and what makes sense for you is the way to go. But when we're talking Medicare supplement plans, there are only really a few options that make the most sense. Plan G, Plan N, or possibly Plan GHD. And it really depends on where you live because some states, they're very competitive, very affordable. Some states have introduced additional mandates and regulations on insurance carriers to give you more benefits or more accessibility, which is great, but it also makes the costs go up. So the premiums are higher. So in certain states, we have to work harder to make sure we get the best value. And then in other states, they do make it easier to get in or get out or change and things like that. So there are some complexities kind of state by state. But what we try to do is my goal is to find a Medicare supplement plan very close to $100 a month. And that is really the primary target. You know, in some places it would be Plan G, which would have the most benefits, which is great. But in other states where Plan G might be higher, if Plan G is in the 120s or 130s, then we're certainly going to look at Plan N. And Plan N is also a terrific option. And if it's closer to that $100 a month, then that's terrific. And then in some states like New York or Washington State, there are some states that really have some strict policies involved that make costs go much higher, where if G and N, I mean, sometimes in New York, G can be almost $300 a month, which is crazy. It's the exact same plan as it would be in any other state, but because of what they do in New York, where they take out medical underwriting and things like that, just makes the costs go through the roof. Then Plan GHD would likely be the choice, and it'll be less than $100. But again, we figure all that out and we help you understand how they function, so that way you know what you have, and that's the most important part. When you go to the doctor, you go to the hospital, you're not going to be wondering what your costs will be. You will know what your costs will be, and you can tell your doctor's office exactly, have you met your $240 Part B deductible, and if you have, if you got a Plan G, that's all you're ever going to pay. If you have a Plan N, you might have a $20 copay. If you have GHD, it's going to be an 80-20 until you reach a certain level, and then it's going to be 100% the rest of the year. So just want to make sure that we understand it. And again, Original Medicare is fantastic. You don't have any pre-authorizations. You don't have any network of doctors, network of hospitals. You don't have to jump through hoops and do things to make sure you get what you need. Pretty much, if your doctor wants it or recommends it and you agree, Medicare covers it. It's a completely different scenario with Medicare Advantage. And Medicare Advantage, on the cost side of it, can be just significantly different and confusing and convoluted. The best thing about Original Medicare with supplements is they are standardized, meaning they're exactly the same plan to plan. So you know exactly what you have. A G is a G, an N is an N. Medicare Advantage is not standardized, so they can have a completely different set of benefits and operations where you can have HMO or POS or PPO or PFS. There are just a number of different ways where it just puts you in a position that you don't understand what you have. Now, a lot of Medicare Advantage plans may have what they show as zero premium, but then the out-of-pocket costs within it, when you use it, will be significantly higher. They can have a maximum out-of-pocket annually of as much as $8,500. So some have different ones. If you have a premium-based plan, you might have a larger network of hospitals, a larger network of doctors. You might have lower max out-of-pocket. But again, it just convolutes everything where it's hard to comprehend exactly what your benefits are going to be until you're in the middle of a significant health issue. And one of the biggest reasons that I would not choose a Medicare Advantage plan is that network scenario where you have to use doctors that are in their network, have to use hospitals in their network. I've seen too many times where somebody is in the middle of a significant life-altering procedure that may be terminal or may be chronic, may go on the rest of their lives, and all of a sudden either their doctor or the hospital that they use leaves the network. And when that happens, they have to pretty much start from scratch somewhere else with what they're doing. And that is just a ridiculous scenario. Again, if you are facing cancer or something that is going to be life-altering and changing, just not something, I want control over what I'm going to do. And with Original Medicare, you control everything. You can go to any doctor, any hospital, anywhere in the country without asking permission. It just makes things just tremendously more comfortable when you're going through something like that that could be life-changing. So that gives you a pretty good overview of the costs that are wrapped up into Medicare. And again, a lot of people thought there weren't any costs coming into Medicare, so we understand it. And again, what my goal is to keep somebody on original Medicare, A and B, with a supplement, with a drug plan, if needed. And what I would like to see is the total monthly cost be less than $300, including the Part B premium, including the supplement, including the drug plan. Keep it below $300 a month. Now again, Irmaa may factor into that and jump your Medicare Part B premium over $300 a month all by itself. But that's where we want to be. The majority of people fit right in there. And you know, if we're going at a $300 a month medical premium cost and coverage is fantastic, very little out of pocket when we use it, that's about as good as we can do. And we can go to any doctor that we want that takes Medicare. So that's certainly the way to go, in my opinion. And again, we're happy to help with that. You're welcome to utilize any of my information. Download my book. It'll be a terrific resource for you now and in the future. Give us a call. Fill out the form on my website. We'll email you a quote. If you want to use us, that's great. If you don't, if you want to use us for comparison against somebody else, I certainly understand that a lot of families have a Medicare agent in their family, and sometimes you have to use that Medicare agent in your family. We want to make sure they know what they're doing, and not what they want you to do, but what you want to do, and to make sure that we get it right from the beginning. So I hope you found this helpful. Make sure you watch video here. You'll find that helpful. There's also this playlist that if you're starting Medicare, this playlist runs through a lot of different topics on starting Medicare. So I hope you found all this helpful. Have a fantastic day.